This conference will now be recorded.
Good afternoon, everybody, and welcome to another one of our speaker series events. Today is the 20th of May, and we're here with Julie Cullen, who is a licensed clinical social worker, education, which is a master's in special education as well. Graduated from of the University of Vermont in '99 with a bachelor's degree in psychology before enrolling in the graduate program at Boston University. She graduated with her master's in social work and a master's in special education. Her professional career began in residential treatment, where she received intensive training in both dialectical behavior therapy and treatment of developmental trauma. She spent some time in therapeutic public school environment before opening up her own practice in 2012. She works with children and adolescents and families, and she hopes to bring humor, knowledge, and empathy into the experience to bring out the client's resiliency and to provide families with a sense of hope for the future. Ladies and gentlemen, without further ado, Julie Cullen. Thank you so much for coming.
Thanks so much for having me.
Thank you.
Sense of hope for the future is a big one these
Yes, that's
days.
right. I know. I smiled when I was saying that.
It's been there for a while, but yeah, right now there's a lot of that going on. Um, so I am a private practice therapist. I have been in this role since 2012, and really started full time probably 2000, about a year after. So I was kind of doing this on the side while I was working in a public high school for a while, and then decided that this was the right move full time for my career. Um, Pretty much, it's funny right now. My day to day is so different than what it's been for the last 8 years. Um, but prior to this, a typical day for me starts in the afternoon. I work with kids and families. So I have to be available when kids and families are available, which is after school and after work. So one of the things I love about my job is that there's a lot of autonomy and flexibility in what I do. I schedule clients when they're around, but also when I'm available. So I can work every day if I want, or I can take a day or a week or whatever I need for other things in my life. That flexibility has been huge. So typically I work about 3 nights a week and one morning where I see parents and more adults. But 3 nights a week I'm working with kids and teenagers. I see them one-on-one, sometimes with a parent, and we spend an hour together really trying to problem solve and figure out how to make things that are tricky a little bit easier. Um, and outside of those individual hours, I do a lot of consulting with schools, talking with doctors, with medicine providers, and other types of professionals who might work with the person as well. Um, and I think again, the biggest piece of all of this for me has been that autonomy. I get to kind of create the environment that I want to create in my space. So when you come into my office, there's I work with a varying age group. So my youngest client is 5, and my oldest client is an adult. So there's a lot of everything from toys to coloring to worksheets to a whiteboard in the middle of the table that sometimes is used for, making a good point, and sometimes is used to just color and distract while people are talking. There's just all kinds of stuff, and it's there purposefully to give people a way to be comfortable and find what they need in order to talk about the things that are hard. So one of my favorite things is when I have an older kid, teenager, 17, 18, or even older, and they'll come in and sit down and without realizing it, start playing with toys. Playing with, they'll pick up coloring and they'll just start coloring, or they'll start playing with the dollhouse and not even realizing that they're doing it, but building that level of comfortability that at 18 years old, they feel like they can let their guard down and, really kind of just do what they need to do in order to talk about the things that are getting in their way. I pretty much try to create an environment where whatever it is that you need, we can do. You need to come in and get comfortable, take your shoes off. My elementary school kids will come in and take their shoes off right away, every single time.
Yeah.
And their moms will come in behind them like, oh, put your shoes on, take your feet off the couch. And I'm like, no, it's okay. Those aren't rules here. We can do what we need to do. I think it's hard. I think going in and talking to somebody and letting your guard down and talking about things that you struggle with or that scare you or that worry you can be a really difficult prospect. So my feeling is that it's not up to me what you need to make that happen. It's up to you. So you can do those things in my space. You can be whatever you need to be in order to get out the things that you need to talk about. It's different. It's certainly not, my space is certainly not a clinical space. It's not neat and clean and orderly and functional. It's very open and flexible, as that's what I'm trying to teach people, is how to be flexible and how to use their strategies to move forward. So that, in a nutshell, that's pretty much a day. I'm home in the mornings. I do whatever I need to do in the mornings. I get to work about 2 o'clock. I usually see about 5 or 6 clients, close up around 8 o'clock, get home, eat dinner, and go to bed. I pack my own things in the morning, and work is kind of where everybody else is doing their stuff. But again, the great thing about it is it's flexible and it's mine. So if I need to switch it around one day, I can switch it around. My summer schedule is very different than my school year schedule, because it can be. And I have that ability to do what I love to do in a way that works for me, which is probably the best part about this particular setup.
All right, geez, well, the questions are already starting to flow in.
Great.
All right, cool. Do you have a particular focus with child behavior?
I see probably 85% of my caseload is anxiety. I see a lot of anxious kids all through the age spans. And then I see a lot of elementary aged ADHD boys. So my focus with kids who come in with anxiety is really to help them put the things that they're worried about in perspective and find a way to be able to function despite, because some of the things that they're worried about, particularly right now, they're valid, they're real, but we still have to kind of put one foot in front of the other and function in the world. So how do we do that despite these anxieties? And with my attention kids, a lot of it is executive function training and working on how to stay on task. How long can we do this one game before we move on to the next game, and really kind of helping them to figure out how to pause and slow down and take a breath before reacting to stimulus in their environment.
All right. I guess now I have a couple of follow-up questions. When you're working, you mentioned working through anxieties. Now,
Yes.
which anxieties or being anxious about what? Like, is there? I'm sure that's a super broad question, but
Yeah.
is there like a couple of top 5 things?
I would say top 5 things. Let's see. Well, certainly right now, there's a lot of health anxiety. Health anxiety and anxiety about the well-being of people around them, grandparents, parents, people that they know in high-risk categories, which also, it falls into health anxiety in the sense that it's health of other people. So that's a big one right now. I think there's a lot of middle school age anxiety around social issues. Lots of particularly middle school girls. We do a lot of work around social anxiety and understanding social dynamics in the social landscape. And that creates a lot of stress for kids. And then there's a group that's working really through perfectionistic kind of stress and anxiety. I have to get all A pluses. I have to be in all AP classes. I have to be the best at everything. And if I'm not, I'll never make anything of myself. So we do a lot of work on finding the gray areas and recognizing strengths and weaknesses and accepting things that are hard and letting them be hard, and trying to find that ability to feel okay about not being perfect. So I would say that those are some of the big ones right now.
Yeah, it's funny working with the scouts and doing all the summer camps and things and the wider range of age groups. You can see where the transition is, and
Yes.
has their own individual thing that they are worried about.
Yep.
We have a question from the audience as well. So Cindy and Evan, always those are the people who I said always have some great questions. And
Yes.
so this one is a question from my mom. Said, so what changes have you seen in the approach to your work since, say, like 20 years ago when you got right out of college? It seems like a different approach.
Yes. I think, coming right out of school, I went into a residential environment. So there was sort of like a curriculum. You were teaching skills, and it didn't really matter so much. Not that it didn't matter what was going on, but you were really focused on teaching skills and practicing skills and working on behavioral rehearsal and doing, I did a lot of that work initially. I think what has happened over the years is that I've really started to realize that we as therapists, we can give you all the skills in the world. We can hand you a book of strategies to use. But if you don't understand how they fit into your own life, they're kind of useless. So I've really moved from just teaching a bunch of skills and hoping that you're going to figure out where to put them, to really trying to dig into what's going on in your world and what strategies are the most effective for your constellation of, environment, social situations, needs, strengths, weaknesses, and really pinpointing and doing it in a more natural way, as opposed to just sort of throwing skills out there. I think that's probably been the biggest change. It's much more of a process, of what, let's talk about you as a person and what you need and how we fit in what I have into what you're doing, instead of take this, figure it out.
All right. You mentioned how some people might seem, or you mentioned how your office space is,
Yes.
like so people can adapt or be more creative.
Yes.
Do you think people end up ever walking in there, or maybe your first time, I don't want to say customers or clients,
Yes.
they ever surprised at the office
Yes.
area? Like really? And you mentioned about how it's good for them to adapt. How do people receive that? Like it's a change for them, I'm sure, to even go to
Yes.
the therapist, but in that regard, how do they deal?
I've had a couple of different reactions. I have a longtime client who came into my office after, years of coming to see me. And she came in one day and she had gotten a glimpse of somebody else's office in my suite. And it's a little bit more calm and, like there's lighting, and she did a really nice job. And she kind of peeked in and she came into my office and said, "How come your office can't be more like that?" I was like, "Well, there, she's open. Go ahead."
Yeah, right.
So there's definitely sometimes a reaction of like, wow, there's a lot of stuff in here. But I think that, it's interesting to watch the evolution, because initially I think, yes, people come in and they're like, okay, I don't even know where to start. Even the little kids will kind of come in and be like looking around and touching all the different toys and looking in drawers and looking in bins and trying to figure it all out. And I would say within 3 or 4 sessions, people kind of settle in and they come in and it doesn't feel, they know where things are at that point, and they kind of come in and they go to their spot and they go to their thing and they get their, whatever it is that they need, that they've decided works for them. And, so for some of the younger kids, it's picking a particular toy or a particular set of toys that they continue to go to. And for some of my older kids, it's like moving everything off the table, getting under the blanket, taking their shoes off. I have a couple that like curl right up on the couch, and just kind of like clearing off the space so that, they can play on the whiteboard or whatever their, kind of their thing is. But I think that that's the biggest thing I see, is sort of an initial shock at all the options and then a settling into whatever it is that's going to work for them. And they sort of come in and create that space for themselves. in the first couple of minutes.
All right, yeah, I like that. Oh, again, from the mom of Cindy and Evan, um, who should honestly be co-hosting this with me. So you're talking about executive function coaches.
Yes.
How do you work with the overlap with their services and thinking about ADHD specifically, trying to
hmm
balance the EF, the SR, and the emotional pieces holistically speaking?
It's tricky. It's, there is definitely an overlap, and so I typically, with the younger kids, am starting out with trying to get a sense of what skills they struggle with and what skills they have, because every kid who presents with ADHD is presenting a different constellation of strengths and weaknesses. Initially it's getting an assessment of what are we actually working on here? What are the deficits? Where do we need to build? And the reality is that in order to manage the emotional pieces, there are executive functioning skills they have to have. And emotional control is an executive functioning skill. So they need to be we need to be working on task initiation and emotional control and response inhibition and some of these different skills in order to be able to get to the emotional parts of ADHD. So, if a kid is blowing up at small issues, having issues with friends because they're getting overly angry about small disagreements or things like that, we need to look at response inhibition and how do I help him or her, learn to use a red, yellow, green system to take a step back, think about the problem, and then respond instead of immediately reacting. That's hard for kids with ADHD. And if we don't look at the executive functioning side of it and try to just deal with it as an emotional piece, we're not going to get very far, because those two are so tied together. So it's really kind of assessing what's emotional, what's executive functioning, how do they fit together, and how do we teach the skills behind the scenes in order to be able to support better emotional regulation.
Do you recommend that dual approach in this case? And with two
Oh,
providers or just one?
um, it's great when we can have two providers. It's excellent when you can have the executive functioning coach and a therapist on board. It's not always possible. When it is, it's ideal because you're getting both sides of it. You're getting it from a structured learning perspective, and you're also getting it from an implementation, in the moment kind of perspective. Um, I have my experience is that it's hard to find situations where kids are getting both.
When you keeping this thought process going, when you're in schools and you're doing some consulting and things,
hmm
what do you advise schools on in terms of maybe this scenario? Or I noticed I've done some work in another school where they had like separate quiet rooms and different,
hmm
because now I'm thinking about your office, like a
Yep.
safe space that's in between or one every hallway. So
Yep.
is that something that you consult schools on, or how's that work?
What I've done with schools has typically been client specific. So I've worked with teams when kids have had IEPs and things like that. I've worked
Hmm.
with teams on building in interventions for particular clients, not for necessarily for school as a whole, although I would love to do some of that work. But with individual clients, when I've worked with schools, we've looked at some of those strategies and where can we kind of place a space where they can kind of go organize themselves. Because the thing with kids of that age too is, too much stuff is a problem and not enough stuff is a problem. And we have to find that middle ground of like, where's enough stuff for them to be able to make sure that their energy is going into the right spot. Um, my 10-year-old was recently diagnosed with ADHD, and we've been playing around with this now that we're remote learning and trying to figure out, how does this work at home? We've got a system for him at school. How does this work at home? And it's a very similar process of what I'm doing when I'm working with clients in terms of like, okay, if we have all of these things around you, that's too much. So what are the ones that are really important? And really making sure that the important things are there and available, and kind of pushing away the extra. So like for us, we have in the office space, we have putty and we have little figures with arms and legs that you can move around, because he can
Okay.
kind of stick those under the desk and play with them, and his hands are going, but he can look at the screen and listen to the meeting or whatever he's doing. But if we have Legos, or if we have Magnetiles, or if we have, God, whatever other toys he has that he tends
Right.
to bring in here, then he's distracted and he's playing and he's not actually paying attention to the meeting. So when I'm working with schools around how to support kids, that's what I'm kind of looking for, is like, what is effective and how do we keep what's effective available while taking out all of what becomes a distraction, and how do we tell the difference?
All right. I originally had a question of, does your job follow you home sometimes? But more or less, I think I just swapped that around to, how do you separate your
Yep.
job from home now? Like, how do you go? What's your process to kind of clear your head after a long day of helping others, and then
Right.
going home to deal with your own stuff, as you mentioned earlier?
It's, on a good day, it's challenging, but I
Hmm.
have my commute. And so that's always nice. I
Okay.
also, having a reverse schedule in a sense helps, because, you typically during the morning when I'm home, my kids are at school. So I have all morning to kind of, I, get any chores or groceries, the sort of personal
Sure.
things done, get to the gym, get myself in a good space. Then I go to work, and then I have my commute home. And so it's really the early mornings and sort of the late night bedtimes that I'm dealing with on a typical day. And I have my commute to kind of separate that out. Um, and then because again, I'm working for myself, I have a couple of days off during the week where I'm fully at home, and I can just kind of, I essentially tell people on Tuesdays and Fridays, I don't answer the phone, I don't answer email. I'll get back to you on Wednesday or Monday, and
Yeah.
that tends to work. Right now, it's much more jumbled, and it is definitely more challenging. And it's one of the more challenging pieces that I found about this situation. I'm seeing a couple clients in the morning, I'm seeing a couple clients at night. In between, I'm doing school and outside time and entertaining my own children. And, there isn't that balance. Um, it's much harder to create, and it's much harder to set those boundaries where, somebody emails or sends a text or sends, a message through my website, and I have my phone and it's there, but I'm with my kids. And when is it okay to check, and when is it not okay to check? And can I just leave the notification there and not check? I can't. Um, so it definitely is a harder balance given the situation that's happening right now. And I think that a lot of people in a lot of jobs are finding that, um, that separation isn't there, and it creates more of a challenge, to keep work at work and home at home. And with this particular job, the issues and the problems start to blend, and the stress level increases. And so I've definitely had to figure out a way to kind of pull back and have a spot, um, at the end of the day where I'm stopping, I'm putting the phone away, I'm not thinking about any, work, I'm not entertaining, and I just take a half hour or so to kind of separate everything out so that I can function my best in all the different environments that I'm in at the same time.
Right. Which sounds like you could be a professional juggler.
Oh, it's interesting.
Yeah.
It's been an interesting 10 weeks.
Oh, sure. Speaking of 10 weeks, have you seen more clients, any new clients, or more of an influx of need for therapy during
Yeah.
these times? Like, are people's own, say, neuroses or idiosyncrasies really bothering them more, and they need, a guy I work with at work always says, better out than in, so
Hmm.
is that like a influx
Yes.
of business, I suppose?
Well, and so working with the population that I work with,
Hmm.
I would say that in general, over the last 2 or 3 years, there's been an influx of need to begin with. There's not a lot of people that do this. There's not a lot of people that, particularly with the younger kids, that work with the younger kids. So business in general over the last 3 years has seen a real influx. NASW, National Association of Social Workers, released some numbers a couple years ago, a year or so ago, saying there was a 40% increase in referrals for behavioral health and a 4% increase in practitioners coming into the field. So just a huge amount of need without a lot of people coming to do the work, which is unfortunate. because it's so important. And then add this situation on top of it. What I'm seeing right now is people who kind of had things under control and had ended sessions coming back.
Yeah.
I need to come back in. I need, and so I've restarted with several, previous clients. And I have probably an average of 6 to 8 referrals a week that I'm having to say, I can't help you right now. I would say that's up from, before COVID, it was probably 4 to 5, and now I'm up to about 5 or 6. But there is a huge need for people to work with this population in this field. And I think that's only going to grow, because I think what we're going to see after this is that a lot of things, a lot of fears, a lot of anxieties, a lot of concerns for the future are really going to be triggered. And we're going to see a lot of kids really looking for some extra support.
Job security.
It is. That's for sure.
Yeah, but with all seriousness, it's such a healthy thing,
Mhm.
to do, I believe in. As we're coming up towards the end, is there any advice that you would give any young person who might be wanting to go into that field? Any
Yeah.
tips, or even any suggestions for everybody listening?
Yeah.
Tips for life.
Sure. I would say, connect with someone and with a professional who's in the field. Think about the types of environments you might want to work in, and whether it's private practice or working in a school or working in an outpatient clinic. Like connecting with people who are doing the work in different settings to kind of figure out what feels like the best fit. Social work is such a varied profession. It's one of the things that drew me to that over something like a counseling degree or psychology or something like that. There's so many different things you can do as a social worker. So I think really talking to people and networking and communicating with people in the field is a great way to kind of get your feet wet and start to understand what it is that you're looking for out of this profession. In terms of going into private practice as well, it's a very different world from some of the other things that I've done. And there's a lot to know, and there's a lot you learn along the way, but there's a lot of things that are nice to know before you get started. So it's always good to talk to somebody who's in it. And in terms of sort of life right now, we got to be flexible. We got to roll with it. We got to live in the current 2 weeks and try not to get too far ahead of yourself, because everything changes quickly. You can't count on too much too far out. So you just got to stay in the moment and stay focused on what's happening now. And that's how we get through this.
Absolutely. Yeah, I always say one day at a time.
Yep. I said, don't look further than 2 weeks out, because in 2 weeks, you have no idea what's going to be happening. So if you're worried about something after 2 weeks, then just leave it until you get closer, because you just don't know. There's no way of knowing.
Thank you so much. Ladies and gentlemen, this has been Julie Cullen, who's a licensed clinical social worker, and you've done great things. And thank you so much for being on this, and good luck with everything else going forward.
Thank you. Thanks for having me.
Thank you very much. Have a great afternoon.
You too. Bye-bye.
Be well.